Welcome to Combos from the Couch by LifeStance Health, where leading mental health professionals help guide you on your journey to a healthier, more fulfilling life. Hello, everyone, and welcome to our 2025 Pride episode of Combos from the Couch. In the last several months, we've witnessed a concerted effort to limit the rights of trans individuals, particularly targeting access to essential care for trans youth. These actions have sparked significant concern and debate, and so I'm grateful to be joined today by Melanie Falls, Han Wetmore, and Dr. Shane Miller to discuss the importance of gender-affirming care. So welcome, Mel, Han, and Shane. Great to have you on.
Thank you.
Thank you.
Nice to be
Thank
here.
you.
All right. I'm going to have you guys tell us a little bit about yourself, and we're going to start with Melanie. So tell us a little bit about you, Melanie.
I am a licensed independent social worker. I've been working in the field for about 35 years now. And I work a great deal with LGBTQIA clients. I'm on the board of directors for the Human Rights Campaign. We do a lot of political work and a lot of legal work around these issues that are affecting LGBTQIA people. So it's a good kind of foundation to the actual clinical work that I'm doing with everyone.
Great. Thank you, Mel. Definitely always appreciate you coming on and sharing your expertise on many topics related to LGBTQ. So thank you. Han, tell us a little bit about you. I know you've been on before, but go ahead and let's go.
Absolutely. My name is Han Wetmore. I use any pronouns. I am a non-binary clinician. I am also a licensed independent social worker. I'm also a clinical supervisor here at LifeStance, and I provide care to a variety of clients, just as Melanie does too, but I also have specializations in LGBTQ plus adults, in particular older adults. So I do provide gender affirmative care medical readiness evaluations for transgender adults here in Ohio. And the majority of my caseload is queer in some element. And I do also have a little bit of a background in hospice and end-of-life care as well, which does especially inform my practice with LGBTQ plus older adults. And I've been working in the field since, I think it's been about 6 or 7 years for me.
Great. Thanks, Han. Appreciate all the good work you do with your clients too. Thank you. And Shane, you're new to our podcast, so definitely share with us a little bit about you.
Sure. I'm a licensed clinical psychologist in California, and I provide psychodynamic, insight-oriented, relational-based care to multitude of populations, including the LGBTQI. My pre-doc work was done at the LA LGBT Center, where I worked with a lot of genderqueer and gay and lesbian clients. I also have a private practice. I had a private practice. I now have been with LifeStance almost a year, and I see just all kinds of anxiety, depression, eating disorders, grief, gender identity, life transitions, individuals, couples, and groups.
Great. Thank you. Definitely sounds like you come to this conversation with lots of great experience related to this. So great. Thank you.
Thanks.
All right, let's start ourselves off here and talk about some of the laws around access to gender affirming care, even specifically to transgender youth. So Mel, let's have you start us off with that.
Okay, this topic could actually probably be the whole podcast if we let it, and even more. Basically, since 2023, we as a country have seen 530 anti-LGBTQ bills introduced in state legislatures across the United States. We are also seeing on a federal level attacks on the trans community. For instance, the trans military ban. HRC actually is the principal in bringing suit against the government to override this. We asked for a stay last week. They denied it. So it's still in process, and transgender folks are still going to be discharged from the military now, and who knows how long. Ohio in particular has had about 9 bills that are anti-trans. Some of them passed, some of them still in process. The big one is HB 68, which does two things. First of all, it outlaws transition care for youth under 18, not just surgical care, but hormones, even the soft transition skills are outlawed. It also bans trans women from playing women's sports in Ohio. It's been that law has been, it's indicative of, the process is indicative of a lot of the laws that are happening, not just in Ohio, but in the other states. For instance, it was passed in the House and Senate, vetoed by the governor, overridden by the House and Senate. And now the ACLU has a case which will move to the Supreme Court. They recently got a stay, tried to get a stay on it. They could not. So it is still in effect and they are looking to get it overruled, but it has to move up through the court system to the Supreme Court, Ohio Supreme Court. There are other bills. There's a Don't Say Gay bill that is outlaws schools from giving any information on LGBTQ kids, having books in the schools. It also forces the school to out a child, even where there's a danger that the parent may do many of the things that parents do, disown the kid, throw them out. That's in the works. That's the Parents' Bill of Rights, it's called. I could go on. There
Right.
is,
Gosh, so many.
yeah,
It just feels like an
so
uphill
many. So,
battle.
and
Yeah.
yeah, like I said, we could spend a lot of time on this, but I just wanted to talk about that as an overview.
Right. Oh my gosh. Thank you, Mel. Han, Shane, anything you'd like to add?
It's interesting because in January of 2025, California passed a law that pretty much does exactly the opposite of what Melanie is talking about, which makes me proud. So this law prohibits outing any
Wow.
kind by administration or teachers, any kind of release of private information. Kids can play on the team that is the sex that they identify with, not that is their necessarily on their birth certificate. And it even protects children and families from any retaliation by states outside of California for whatever treatment they have been able to
Wow.
get here.
Wow.
That was January of 2025. It feels like things shift everywhere, minute to minute, but that law is, from my understanding, still currently in effect. That's about the laws. The value of the gender reaffirming care is very important because for self-identity, for the ability to thrive, it's supported here in California. And UCSF, University of California, San Francisco, is one of the main resources here in California that provides gender affirming care, not surgeries. And they work with kids, I believe, 8 to 17. And then they can transition into the young adult program. And I don't know that they provide surgery for young adults, but they don't for children, but they do provide hormones, they do provide letters, and they're really supportive. So
That's wonderful. Sounds like Ohio needs to take a few lessons from California with this.
once again, everything seems to be in flux always
Good
right
point.
now, but
Got you. No, thank
for
you.
now it's good.
Han, any thoughts?
Nope, I have nothing, honestly. Melanie is the one doing this, the direct political activism, and she is very much in tune with what's going on in the laws. So I don't have anything to add. She is 100% on point.
And you know what? This is a good segue. Maybe you could talk to this point here, Han, of when we're looking at gender affirming care, sometimes what we're looking at among many things that trans and even non-binary individuals are navigating, maybe looking at gender dysphoria. And would you like to lead us into that conversation of telling us more about what it is? And maybe we can all talk about also too of like how we help individuals who might be struggling with that.
Absolutely, absolutely. So the clinical definition of gender dysphoria is essentially an incongruence between the individual's self-identified gender identity and their sex assigned at birth. For example, even though I am non-binary, this is something that's discussed in the trans community about whether or not non-binary people are trans. Most people agree that non-binary people fall under the trans umbrella because my sex assigned at birth is female. However, I identify as agender. I do not identify with having a gender identity. So because of that, I am trans, and therefore I fit the diagnostic criteria for gender dysphoria. So that dysphoria needs to create a level of significant distress in that individual's life. So, for example, I have trans clients that I have not diagnosed with gender dysphoria, interestingly enough, because they live very authentically themselves. They don't experience any dysphoria anymore now that they are post-transition. So therefore, it's not a focus of treatment. I have many trans clients where their identity simply just is not a focus of it. I also do have a lot of trans clients where their gender dysphoria and helping them learn how to manage it, both medically and also non-medically, is a significant focus of treatment. So the evidence-based best practice for gender dysphoria, pretty much this has been supported by evidence since as far back as the early 1900s, is the affirmation of the identity that the person identifies with. Gender is how you feel, sex is what you are assigned at birth. So in order to ensure that person has the best mental health outcomes possible, it's critical for a clinician to validate and support and normalize an individual's gender identity. And by doing so, the provider creates a sense of safety in their office, that the person can show up and be authentically themselves. And for some trans people, managing their gender dysphoria does utilize medical transition. I am somebody that I've had gender affirmative surgery, and it's something that has been phenomenal for me and has really led to a significant improvement in my mental health too. However, there are also plenty of trans individuals who simply never go through any form of surgeries, or maybe who don't necessarily need to access hormones. And yet there are also trans people that do a full transition to what we would consider the opposite sex. It is a lot of deconstructing the notion of gender and sex being inherently tied to one another, because they very much are not. And also demonstrating that gender is a spectrum. And actually, to a certain extent, biological sex is also a spectrum too. We very much put people in a box of male and female, but there can be a whole myriad of genetic differences. Intersex people exist as well too. In fact, actually, there's a lot of evidence to suggest that intersex people are more common than we even think medically.
Right.
So essentially that is what gender dysphoria is in a nutshell. I will also say too, gender dysphoria is very much socially and culturally defined too. So different societies on Earth in different countries have a different definition of what gender dysphoria is, and also have a different concept in general of what gender is too. So the American definition of it, from what we know, is that it is the incongruence between somebody's identity and somebody's sex assigned at birth.
Great. That's a wonderful answer there, Han. Shane, Melanie, anything you'd like to add?
Listening to Han, I did my thesis a long time ago on gender identity and did a lot of background work in developing the thesis. And I think what's interesting and what many people don't know is this idea of being gay, being transgender has been around for a long time. And there were
Getting
like the
human history, in
Kinsey's
fact.
study in human history, even recent history, like the Kinsey's study that Freud had the concept that everyone is born asexual and that they develop into their identities as they grow, which I think it's interesting to mention because some groups would have us think that this is a new concept, or that this is a concept that is being influenced by pressure from the gay transgender community. And it's absolutely not. The reason that we're hearing so much about this is first the great work that was done in the gay and lesbian community, marriage equality, et cetera, which kind of elevated the visibility of LGBTQ people. And then the decision and the focus groups that were done that showed that people don't understand transgender people, and they're scared of them, basically scared of what it is, who they are. And so it's been used as a very surgical wedge to inform people, misinform people, and has become a political pawn. So
That
it's,
sums it up right there. Definitely. Shane?
I just want to add that the transgender clients that I have worked with are some of the most resilient, self-aware people that
Yeah.
that I've ever been exposed to, and I am deeply respectful of who they are and what it takes to acknowledge how they feel and to determine for themselves what action they want to take to create that congruence, if you will. And so that's all. Just we can talk legally, we can talk medically, and just emotionally and spiritually. That's all I
Yeah.
wanted to.
No, my gosh. Thank you. So this is the key question here. So why is gender affirming care so important for youth and adults? Whoever would like to kick us off first.
I'm happy to jump in to start.
Yeah, fine, go right ahead.
We're going to be starting on the opposite end of the life spectrum, so sorry about that. But because I work primarily, right now I don't work primarily with older adults, but the majority of my clinical practice before Life Stance was older adults, and I still have a fair number of older adults on my caseload too. There's quite frequently discussions about the fact that queer people in general, across the board, transgender individuals in particular, but especially anybody that identifies under the LGBTQ plus or queer umbrella, they generally have a shorter lifespan due to the influence of all of the factors that essentially goes into the marginalization of queer individuals. So queer people are significantly more likely to attempt or commit suicide. They are also significantly more likely to have mental health issues. They're also significantly more likely to experience the toxic effects of poverty, systemic oppression, and oftentimes marginalization from medical providers too, and prejudgments about their conditions. So it's oftentimes interesting to talk to LGBTQ plus older adults because of the fact that many of them feel they have a lot of survivor's guilt. That, like, I've had clients who have had partners that have died during the AIDS epidemic, or clients who have had partners that have completed suicide, or children or loved ones or anybody in their lives that have attempted or committed suicide, or maybe who are seriously mentally ill. And it's the perception of aging is seen as a privilege to queer individuals. Affirming one's gender identity actually does help expand that mortality and gives people a better prognosis simply for living, because their mental health is better managed. They are far less likely to attempt to take their own lives, and they have the ability to actually live more authentically themselves, which then just overall leads to better outcomes.
I agree. Mel? Shane?
Well,
Go ahead, Shane.
Go ahead, Shane.
Okay. For youth, it's very important for early acceptance, early support. We can talk about the clinical care that children need and the familial support is fundamental in being able to also thrive. There's a website called Trans Family, and they have great resources, including reading lists for children and youth of all ages, how to have these kinds of talks, because the bullying, the feeling as an other is so prevalent, although not within the children necessarily, but from what the adults around them feed their classmates and what have you. So it's fundamental that children get support and understanding and be allowed to explore what will make them feel more like themselves.
Yes, definitely agree with that. Melanie, anything you'd like to add?
Yeah, of course, I agree with everything that's been said. And I think it's important to recognize that all LGBTQ people begin to recognize this at a very young age, and especially trans kids. But they often, given the cultural influence, the negative cultural influence, they often don't even try to express, often at a young age, they don't know, they don't have the words for it, but they know something is different, something is wrong. But if they sense that you can't talk about this, they sense that there will be, even at a young age, have a sense of how they will be received. They don't talk about it. I have a friend, her name is Jody Patterson, who was the board chair for HRC for a number of years. She has a trans child, and she has written a book and talks about it very passionately about her child at the age of 2 being depressed. Just not, she has 5 other kids. And so she had a basis of comparison and not understanding what was happening until her child said to her, this is a female to male trans, I am so sad when you make me wear these dresses. I am so sad. Why do you do that? And then, of course, that started the journey. And as soon as they were able to allow him to talk about it and to express themselves and then do some social transitioning, it was very young social transitioning, but it happened, the depression alleviated. And they've been a pretty happy and high functioning individual since then. So children know, they know. And then if they receive the opposite of that, parents who are rejecting and who aren't willing to even talk about this with their child, they have the opposite effect. Depression, self-harm, often getting into trouble, suicide attempts, sometimes completed suicides. It's a very serious issue.
And this leads us to looking at what advice would you give families supporting transgender and non-binary loved ones? Why don't we have Shane start us off?
Sure. Listen, validate, educate yourself, foster a supportive environment, advocate for your child's well-being, ask for help, look for resources, join groups of other parents, stand up against discrimination, respect autonomy, seek guidance, and mostly keep talking.
Yeah,
Keep talking.
have those
Yes.
conversations.
Yeah.
Definitely. Thank you, Shane. Han?
I completely agree with everything that Shane just said. I'd also like to add too that it's also critically important to make sure that you are also using that person's preferred name if they have one, and preferred pronouns if they
Yes.
also have them as well, because what that essentially does is signal to that queer person, oh, this is a safe person that I can trust because this person respects my dignity, they respect my autonomy, and they respect my identity. And it's very interesting because in the conversations that I have had with trans clients and also my experiences being an out trans person as well, is that we very much develop this survival instinct and ensuring that there are some people that simply maybe cannot know about our identity or that we
Right.
can't explain. So what we do is we hone in on the people that we know for a fact do support us and do affirm who we are as people. And demonstrating that you are a safe person to a trans person, especially in this political environment where it is very actively hostile to trans people, that is critically important, and that is allyship.
Yes. Yeah. Spot on right there. Definitely. Thank you, Han. Melanie, anything you'd like to add?
Ditto to what's been said. There are organizations that are out there, and as clinicians and anyone who's interested in supporting trans people and their families, PFLAG, for instance, is doing a lot of work, trans people as well as their families, which is kind of new to them in terms of the number of people they're working with. There are trans organizations in each state, maybe not all states, but most states. Trans Ohio here in Ohio is one of them. The Human Rights Campaign, we have a whole section of trans parents, or parents of trans people, a committee actually that is there to advise and to help push out realistic information about being trans and having a trans person as a family member. So there is help out there. Sometimes you have to dig a little bit to get it, especially if you're not in the community or know people who are active in the community, but it's there. And it's important that people know and can access these groups.
I agree. And Shane, you had mentioned previously about Trans Family, another
Yeah.
great indelible resource for sure.
Yeah, there's also LA Gender Center. They're a very valuable resource. They have all kinds of things on there. They provide certain services, and they also have resource lists of clinical social workers, therapists who will provide letters, who will work. They have lists for people who, here in California, the state helps if you're on Medi-Cal, which I guess is the equivalent of Medicaid, with if surgical intervention is considered appropriate, they will help get insurance to cover it through
That's great.
Medi-Cal. So there's a lot of different resources, and UCSF, as I said, is really a big resource there.
And if some of our listeners are living in communities that actually has an LGBT center, here in Cleveland, we have an amazing one. I know the LA one. Back in the early 90s, I had the chance to visit the LA Community Center and was like flabbergasted.
You wouldn't recognize it now.
Really?
It's
Wow.
gorgeous, and it's big, and yeah, they provide great service.
I believe
Great
that.
service. Yeah.
So definitely, if you live in a community if you're lucky enough to live in a community with an LGBT center, definitely seeking out resources there as well. Any other insights you all would like to share? Starting with Han, any insights?
I don't believe so. I think this has been very concise and very wonderful.
Great, thank you. Melanie?
Oh gosh, too many to capture in the length of time we have left. I think probably the main thing would be that I know we probably have a lot of professionals, therapists, counselors that listen to this podcast, and I would encourage them to, should they feel drawn to the population and wanting to work with the population, to really educate themselves and get the information, take training, because it's vitally important that in working with trans people and their families, that the therapist be well informed. It's not something that you can just
Wing. Like just winging it.
wing.
You want to be formally trained, truly understand the issues
Yes.
within the community. I agree.
Yeah. Yeah. For instance, there's a document or rules called WayPath, which definitions and terminologies and suggested ways of working with trans individuals. And that's very easy to find. All you have to do is Google it and you can pull it up.
Yeah, great. Thank you, Mel. Shane?
No, I think that this has been really a well-rounded conversation, and I really appreciate everyone's insights.
Thank you. And I want to thank all three of you, Melanie Falls, Han Wetmore, and Shane Miller, for sharing your knowledge and expertise on this very important topic of the importance of gender affirming care. So thank you again.
Thank you, Nicola.
Thank you very much.
I'd also like to thank the team behind the podcast, Jason Clayton and Juliana Whitten. Thank you for listening to Convos from the Couch. Take care, everyone.